Good morning, good afternoon, and good evening to all. Today, I will talk about the continuum of care for hepatitis in the Western Pacific region and getting towards elimination by 2030. Just recently, WHO released the new Global Progress Report with new data. What is clear is that HIV, hepatitis, and STIs are major public health threats, which account for more than 2.3 million people dying a year and represents 14% of all deaths from infectious and parasitic diseases, digestive diseases, and cancer. They also result in more than 1 million people newly infected each day and 1.2 million people developing cancer. Viral hepatitis epidemics are at different stages, as well as regional and national responses. We had success in hepatitis B prevention, which met the 2020 global targets. But to sustain the success and get to 2030 targets, focus in the regions on further reducing transmission of hepatitis B through vaccines and maternal antivirals will be needed. There are regional differences among hepatitis B and C burden and responses as well. And new data estimates that there were 296 million people living with hepatitis B and 58 million people living with hepatitis C globally by the end of 2019. You can find more details in the progress report. In the Western Pacific region, new data show that the region is doing well in prevention through immunization, blood safety, and safe injections. Although harm reduction needs a lot of work, and to get to the 2030 goals for hepatitis B perinatal transmission, additional interventions such as antiviral drugs will further reduce mother-to-child transmission. While many countries have started national testing and treatment initiatives, there remains a large gap in finding the many millions of people who are living with hepatitis. Less than 1 in 5 people have been diagnosed, and overall less than 1 in 10 people are receiving treatment in the Western Pacific region. But we have had progress over the last several years. Today, there are 20 countries, including Pacific Island small states, which have national action plans and are integrating hepatitis care as part of their public health response to scale up access to populations. Access to medicines for hepatitis B and C has seen improvements, with most countries financing this under health insurance and government budgets. However, high costs for HCV DAAs remain challenging in the region, even among countries who have the drug registered and covered these through government financing. Affordability of tests and treatment remains an issue in many countries. Thus, there is more work needed for price reductions for tests and medicines. There has been remarkable price reductions in HCV treatment over the last years. However, actual prices in the Western Pacific region countries are highly variable, and they are dependent on different factors, including volume procurement, the ability to negotiate down prices, patent barriers in the field, market dynamics for drugs, and how and where drugs are supplied, and especially in the Pacific. More countries are now looking into strengthening reporting of hepatitis within their national data systems. However, there remains challenges in harm reduction services for people who inject drugs. Only 2 countries have reached the global health sector strategy target of 300 needles per person who inject drugs per year. And only one country has reached the UNAIDS target of coverage of oral substitution among people who inject drugs. Clearly, this is an area that is lagging behind. More countries are implementing interventions for elimination of mother-to-child transmission of hepatitis B, with about 60% of countries having policies for triple antenatal screening for HIV, syphilis, and hepatitis B. But more and more countries will be providing antenatal prophylaxis and to conduct post-vaccination serologic testing to find outcomes among babies that are born to pregnant women who are hepatitis B infected. We are working on synergies cross-program with non-communicable diseases, NCD, particularly in cancer control and prevention. These ranges from communication planning, aligning to evidence building, to cancer stewardship workshops and integrated service delivery models for chronic care. And to leverage partnerships and networks among the hepatitis and also NCD alliances on the common agenda. But at the end, the cascade of services is what that matters. And this is a work in progress. In the Western Pacific region, for hepatitis B, only 18% are diagnosed and 5% treated. And for hepatitis C, 25% are diagnosed and 10% treated. Clearly, there is much more work to be done. And just a few weeks ago, WHO released the interim guidance for country validation of hepatitis elimination. And this will help countries chart their path on the how to get to elimination and how to measure their success. This guideline articulates the criteria for elimination by 2030 and the different methods to measure the progress. Lastly, we are impacted by the COVID-19 pandemic, and we will need to pivot and adjust to the new normal of working on elimination of hepatitis. And these challenges remain. We will need to work on political commitment and resources and funding to scale up towards elimination. Expansion and integration of services to primary care will be part of the people-centered services. We will need to work with communities and leverage private sector and beyond the health sector. Data systems will underlie decisions for investing, and we'll need to strengthen data systems. We will need to also use innovations and new technology that has grown during the COVID-19 pandemic and take these to scale. Building forward better amidst COVID-19 as the new normal, amidst our ambition to achieve universal health coverage, to ensure people-centered approach to support and enhance primary health care. These are some of the challenges that we will need to work towards 2030. World Hepatitis Day is just around the corner in July, at the end of the month, and hepatitis cannot wait. Inaction today will cost us more tomorrow. We have the next 10 years, or to be more precise, 9 years, to get to the 2030 goals. And I have no doubt that with the menu of expertise, experience, technology, tests, drugs, and tools that we have today, elimination is achievable. Thank you.